So welcome, guys, on this lovely Sunday morning. So who are we? We are Valley Medical Coding. So we do a couple of different things. One of the main things that we do is educate, train aspiring medical coders. So we prepare students for the National Medical Coding Certification Exam, and we also train healthcare professionals on meaningful clinical documentation. Another side of the business that's not in here is we actually also service places like home health agencies, skilled nursing facilities of our medical coding services as well as billing. So those are a few different things that we do. Today, we're going to be talking about the first one, which is preparing students for National Medical Coding Certification Exam. And we've been doing this since 2014. And what this is specifically for the CCS certification through AHIMA. Okay, let me see if that's in the other slide. Oh, this is your instructor. So this is very important because you need to know who is teaching you, how he's credentialed and things like that. And you can easily look him up through AHIMA, okay? If you guys want to do that. So CCS, so Certified Coding Specialist, that is specifically the certification that we teach students. So there are many certifications out there, coding certifications. CCS is basically the main one that you can acquire because this will allow you to work both inpatient and outpatient. If you've done your research, as to how many coding certifications out there. Some of them will only limit you to outpatient settings, like I believe CPC is strictly outpatient. But if you have the CCS, you don't need to worry about any other certifications, okay? So I wanted to make sure to put that out there. So this is your instructor. I'm gonna switch over to the camera real quick so you guys can see him, okay? All right.
Hello, good morning, everyone. Good morning. Thank you for joining us today. You've seen my credential, Zara had already shown you guys the who am I, and I will be, accompanying you throughout your journey in learning medical coding. And like what Zara was saying, what we're going to talk about today, guys, is about the coding credential that you guys are trying to learn. As we explain it, this is something that many of the aspiring medical coders wanted to get because this is a top coding credential that is out there. There are many of them, but we strongly recommend that this is the one that you guys wanted to get. Okay, so Zara, I will have you continue your slide presentation here.
All right. You'll hear from him pretty soon too. Okay, so what do graduates say about VMC, Valley Medical Coding? So these are the most recent students that have passed the exam, for the exception of one, Debbie Jones. We wanted to show you guys a quick video, but I don't think that's working today. So I'm just going to go over what they do. So Abel was a student from last year. He finished around August, I believe, and he did an internship with us. We also offer an externship in our company. Like I mentioned, we also have the other side of the business where we do coding and billing. So he did externship with us. And by December, he found a job, a remote job. He lives in LA, and he found a job in New York, based in New York, as a remote coder. Dufil is from Utah. She was originally from the Philippines, and she found us through, I think, our website. We've been getting quite a few inquiries through our website lately. And she took the class from Utah. And, with it being on Zoom, it's very easy for us to reach out to as many people as we can. all throughout the nation. We've had many students from East Coast, you know, from Central, which is Dufil, and so on and so forth, right? So she was also a student. Was she from last year?
Yeah, so for last year,
Last year as well.
she actually finished around, I think, April, March or April.
Hmm.
And what is important to mention about these recent graduates, guys? Okay, we'll switch over again to camera. Is that because many people ask us how, what kind of support do you guys provide for, when they get certified, when they finished the course? And I always tell our graduates that we're gonna be with you all throughout, even your job hunting. We don't place people like literally like this is the job, because no school, even Harvard, cannot guarantee a job, an automatic job, right? But what we're trying to say here is that even we connect you to our network of professionals and companies that seek for medical coding professionals, and this is what exactly happened to Abel and Delphil. So what I coach them, this is what you're going to do, and it's the same thing that I'm going to tell you guys, that there's ways to to get connected out there, to look for a job. There's ways that you can really do in order for you to get your first coding job, and that's what
Yes.
exactly happened to Abel.
Hmm.
Now Abel is like what you said, Zara. He is working now as a medical coder in a hospital that is
In New
based in
York.
New York,
Hmm.
and he is based here in Los Angeles, and
Yeah. Yeah.
that goes without saying that it is 100% remote, because he can't obviously cannot commute Los Angeles to New York, from time to time. And
Yes.
Dophil, same thing with Dophil.
So for the ones that are intentional, right? Again, we've been doing this since 2014,
Mhm.
and we've helped many students pass the exam. Not everyone follows through, so
Mhm.
just to be honest, right? But again, for the ones that are intentional, we do give them the tools. We
Right.
offer externship. You even have your instructor, which is really your mentor as well,
Hmm.
who will walk you through the entire process, how to apply for the exam once you guys finish. Um, the course,
Hmm.
where to go, who to reach out to, how to even set up your LinkedIn, and that's what you guys were looking at in this screen. These are their LinkedIn, so you guys can even add them. You guys can ask them questions if
Yeah.
you want. If you want to talk to them, on a personal level, you can absolutely do that. Okay, so you can
And
just
let,
reach
let me
out.
talk real quick about this last person here. Um, Debbie
Debbie.
Jones. Okay,
Mhm.
so she
She.
had been, oh, she's not, she had been, become a friend. She had become a friend because before she found me, she was unemployed. She's an RN, but she
Mhm.
was unemployed. She was let go by a company based in Florida.
Yes.
And one day she was like, browsing the internet and saw us
Mhm.
because there was one job opportunity that is being presented to her, but they
Mhm.
were looking for a certification in coding.
Yes.
So she found me, and the rest is history. Now she's a lead physician educator where she works at Henry Mayo.
Mhm.
Yeah, so they actually talked about all these accomplishments in the last interview that we had with them. Unfortunately, that's being the video is being curated for now. That's why it's not available.
Yeah, but you guys can reach out to them if you want, if you
Yeah.
really want to talk to them.
Yeah, so it's same thing will happen to to our graduates, after they have they got certified.
Yes. So these are just a list of the students that we've had in the past and continue to have. So we get a lot of different backgrounds. It doesn't matter what background you have. That's the point of us
Mhm.
showing this slide, whether you're a high school graduate or if you have a medical background or if you're even an RN, right? Or foreign doctors, like from other countries. This class is designed for anybody to join. It's only 24 weeks, twice a week from 6 p.m. to 9 p.m. And it's through Zoom. We've made it so accessible and so easy for anybody and everybody to join. And in the class, you guys will go through, basic medical terminology, anatomy, physiology, and things like that. So if you don't have any medical background, do not worry. Again, we've been doing this since 2010, and we've been able to basically create a program where anybody can join, right? Okay, so what is CCS? So it's a credential. It is internationally recognized coding credential through American Health Information Management Association, AHIMA for short, granted to an individual who successfully passed the National Coding Certification exam, like I mentioned earlier. What is your role as a CCS? A health information professional who reviews, validates, and translates clinical diagnoses, procedures, and health encounters into alphanumeric codes to be reported into claim forms as basis for reimbursement to healthcare providers and facilities for health services rendered. So insurances don't read medical charts. That's where coders come in, right? So coders go through and analyze medical charts, and from there they come up with a mixture of alphanumeric numbers and letters, and those codes are then translated into claims. The claims get submitted to insurances, and that's what they look at. Okay,
Right.
so you are responsible for really reading the charts, extracting codes from there. You will be able to learn how to even read lab results, medications,
Imaging.
and imaging, and things like that. Okay, so that's what medical coding is.
Yeah, I mean, like, yeah, sure. Well, you mentioned, Zara, about this is an internationally recognized certification, and it is. No matter where you live, this is offered internationally. We even have students, coming from the Philippines, and like what Zara said, it's also nationwide. We can pretty much accommodate, people from different places. Now, what you mentioned about, the role of a medical coder is that this is a fun job. I mean, like, I've been a medical coder for quite some time now. It's about 12, 13 years. So when I first got certified, um, you will learn how to, like what Zara said, you will learn how to review, you will learn how to analyze the clinical terms, because this is basically what medical coders do. You may not be a clinician, but over time, getting you exposed to different medical records, you guys will definitely earn that skill, earn the knowledge of almost becoming a clinician. I mean, like, what I'm trying to say, you're not going to be diagnosing, you're not going to be documenting any clinical data, but you will become expert in analyzing, reviewing, and like what Zara said, you will translate those clinical information into codes, and those codes are basis for reimbursement, how hospitals and how those facilities get paid.
And don't worry, you don't need to memorize the code.
You don't need to memorize.
There are a lot. Actually, in the exam, in the national exam, you are required to have 3 books. So don't worry about.
Bring your books.
Yeah, you bring your books, which we provide in the course. It's included in the course fee.
And people ask us, hey, what background is required to start this learning medical coding. And like what Zara had shown you guys earlier, we have helped people from different professional backgrounds. I mean, like, even a high school graduate, a person can pretty much learn this and pass a certification exam.
Yes. All right. So next slide. 3 ways to become a CCS. So you can actually, go to a traditional college, right? That's obviously the first option. They do charge more. It takes a little bit longer. I believe at least 18 months. And I haven't checked recently, but last time we checked is around $20,000. You can self-study, but even very seasoned medical coders need a mentor or an instructor to walk them through this exam. Okay. You'll get to see the books in a little bit. I'll show you what they are. You have to understand the guidelines. And it's more than just learning how to code. So self-study, it's um, it's rarely done. And number three, you can find a company like us, Valley Medical Coding. We do have other competitors out there. And what I always like to say, how we um, uh, differentiate ourselves is you have a live instructor. Many of our competitors do not have a live instructor. They will teach you how to code, and might even go, as far as help you pass the exam. But we get a lot of students from other competitors that took their class, but at the end of the day, they didn't learn everything there is to know about medical coding. What we like to do is we like to train you as if you're gonna be hired after you're done training with us. Okay, so that is our goal. And actually, I think this may be the last time we'll have a live instructor, right? We're trying to come up with a different setup programs in the future. So you guys are actually really lucky to be joining this class this semester because again, we are looking into transitioning into something different. Okay, but this has been how we're different for all these years. You have a live instructor, you have a mentor that's going to walk you through, and it's a lot of knowledge, right? And you can't really put a price on that,
Yeah,
once you.
like you mentioned, getting knowledge from someone who is in practice, actually.
Yes.
Zara showed you guys my credential being, your instructor, but I'd like also to add to that aside from teaching guys, I also work as
CDI.
I'm a practitioner. I'm a CDI. I am a medical coder, and I have been doing that for more than 10 years now. So what I'm trying to say is that I'm not only sharing you the theory of medical coding. I'm sharing you the actual experiential knowledge that I have because talking about updates, what's going on in the industry. I know them. So that's exactly what my students get, when I teach medical coding, because it is important you guys understand what's going on with the healthcare industry as a whole in its entirety, not just, knowing how to code, because,
It's much more than that.
it's much more than that. Yeah.
All right. So job opportunities. Okay, I'll have your instructor
Okay,
take a look.
so job opportunities. So let's talk about of course, medical coder is the top of the list here. You guys are going to be medical coders, um, in many different clinical settings like inpatient, outpatient, and also from specialty clinics. If you opt to work in other facilities like SNF or home health or hospice. So there's no limit where you can work as a medical coder. You can also, perform this role compliance auditor, which I used to do that when I was at Kaiser Permanente. I worked there for about 7 years as a compliance auditor. These are the people that looks and reviews of the medical records, if those codes that were assigned to those encounters were the correct ones. So we look at the compliance aspect of you know, of submitting claims because we want to make sure that before the claims and bills go out of the door, they are really, really clean and there's no anything that is questionable to that claims. Now, you can also become a clinical documentation specialist, which is my current role where I work right now. I work at UC Davis in Sacramento. That's where my employer is based from. But I'm based here in Southern California. So, I mean, I enjoy that privilege or benefit of working remote because, it is what the what the environment what the technology offers these days, so you guys can also do the same. Now, claims management specialists, the next one, are the this type of role, guys, are the ones that the people do when claims get denied, get rejected. So, if those claims were returned back to the facility or the company, these people work those claims, or they, if those claims need to be recoded or need to be need some documentation. Um, Support, then these are the people that do that. Now, you can also become auditors for health insurance companies. By the way, guys, like what Zara said earlier, medical coders don't just work in healthcare facilities. They also work in health insurance companies. They hire a lot of these medical coders because they are the ones that review claims. They look at the ones that were submitted to them because they want to make sure that everything is in the right place. Now, the last one, which I actually bolded, obviously, is you can become your own coding and billing company. And the last one gets overlooked most of the time, guys. I mean, when I started to become a medical coder, I set my eyes on really putting up my own company, and the training company is one of them, right? And also it can happen to you also, like once you get certified, you can put up your own coding company, and you cannot put a price on that because if you have that entrepreneurial spirit, entrepreneurial mindset, then definitely you can actually um, say, ask me and I can mentor you how to go about this. Because, like I said, there's so much opportunities out there. We're not just limited on being employees or work for, you know, for any organization. You can become your own boss. Okay, and the next slide is we talk about what separates VMC from others. Zara already mentioned this. We've been doing this for 10 years of hands-on training. Okay, it's a proven program that has helped many get certified. Um, Let me just talk about that, very quickly. It has, I can attest to that. It has been proven really, really effective because we have helped a lot of people get certified, even those that don't have any clinical background. And this is the same reason why you find, you find me online. People recommended me to, your friends recommended you to us. Is that because we have already left a remarkable footprint in this industry? We are very confident in our skill as mentors, as trainers, because, like I said, our the badge of integrity that we have, really people speak about our support, our style of teaching, and the kind of training that people get. And of course, getting certified is a good way to validate what we're trying to claim. Okay, and the other day I was so somebody called me from one of my students last year, and she told me, "Hey, Eli, I passed a certification exam," and those are, of course, the best or the sweetest news I get, from time to time when someone gets certified to pass a certification exam, and like what happened to them guys, it can definitely happen to you also. And that's what separates us from one of those things that separates us from other companies. What else? We have enhanced flexibility in learning. Here, guys, access to lectures and coding exercises. This is new that we have incorporated in our teaching. Back in the day, guys, we only provide a specific, specific exercise, and you get limited touch on those exercises. But now we have incorporated it in our teaching. Now we give students what we call unlimited access to the exercises, and you will find out later on when you sign up that those exams, simulation exams that will help you guys pass a certification exam in the future are really important, because it kind of like trains you, sets up your mindset when you are to take the certification exam in the future. Okay, so network support and job hunt, and this is very, very true, because those guys that we have shown you in the beginning, like Abel and Duthil, we supported them. We hooked them up to our network, and in the professional community, and they got a job in no time. So we continue to do that because we want our students to be successful, not just in learning, but also getting the job. Free externship, yes, Sarah mentioned that. Free review, yes, it's part of your the course fee that you are going to pay. And like what I have already explained to you guys, it's unlimited simulation test taking exercise, which is we only implemented this year. Okay, now I'm going to turn you over, guys, to Zara. She'll talk about the logistics. Okay.
Yes. Hi. Hello, YouTube. We are live on YouTube, and we're trying to get involved in Instagram as well. So thank you. Thank you for joining us. We're doing well. We're answering medical coding questions today. So if you guys have any questions, don't be shy, and you can put them in the chat. All right. So how much is the course? The course is $4,500. And again, that is 24 weeks. So roughly 6 months, twice a week. I believe the schedule is going to be Mondays and Tuesdays this coming March. So the first day of the class is March 17th, 6 p.m. to 9 p.m. through Zoom.
Right.
How you're seeing us now is exactly how the class, excuse me, is laid out. So you will be given a Zoom link, you will join, and whatever links necessary you need to access will be emailed to you. Okay, so this is exactly how the class is run. What is included? So the books that are included are the 3 books that you will need to take the exam. So these books, just be mindful, they do get updated every year. Okay, so it's very important for you to be intentional. Sign up for the exam as soon as you finish the course, because once it expires, you're going to have to buy a new set of books, and you may have highlighted, made notes and things like that. It's going to be a little challenging to transfer all those to a new set of books. Okay, so
but for these, when you sign up, these books you're going to get this books as part
yes,
of
they will be included.
course.
So that's the
They don't have to
ICD-10. This is your main book, ICD-10 CM Expert, ICD-10 PCS, and CPT 2025. So all of them are going to be 2025. So also, there are a lot of different books out there, and we make sure that you guys have the correct ones.
Yeah.
Okay, so the books are included, and obviously the review as well. So within this class, there are major exams. So you have your first periodical exam, your midterm, your final exam, And even every day you have exercises, you have
Right.
parts to do, and other materials that you'll be getting throughout the course. So all those are included in the course fee. So how to pay? So if you guys can or want to pay the full amount, which is 4,500, you get a discount of $200. Okay, so initially it's going to be 4,300, or essentially 4,300 if you do pay in full. If you cannot, which we understand, then we have kind of like a monthly setup, which is going to be $750 for the first payment, and that is due as soon as possible. Again, the class is starting, and we have already have people registered, bought the books, and sometimes the books can take a little bit of time. So 750, and then the rest of the payments are broken down into 6 months, which will be $625 every month, due at the first of every month.
Mhm.
Okay, so that is the setup. Okay, we accept Zelle, we accept Venmo, and if you are going to use a card, just let us know. Excuse me. There is just an additional fee. I'm not sure what the percentage is. I believe it's like 3% charge. So if you're gonna use the card.